Assalamu alaikum. Hope so you are fine. So today we are going to talk about abdomen. An abdomen is a part that is between the thorax and the pelvis, and it is quite flexible, dynamic container as it holds most of the important organs, especially the abdominal viscera of the body. So here you can see that the diaphragm in this figure will going to lie just here, right? So it's going to be here, right here. And diaphragm is a muscular structure that is present here, and it lies approximately in which fourth intercostal space, right? So from the diaphragm till the superior pelvic aperture, that is the plane of the pelvic internal, we have the abdomen. So this area, this whole region is basically termed as what? Pelvis. And its opening will definitely be here, will be termed as what? Superior pelvic aperture or the plane of the pelvic inlet. So from diaphragm till this pelvic aperture, superior pelvic aperture, we have what? Abdomen, right? So here I will going to talk about the important surface landmarks and planes. If we talk about the pubic symphysis lies at the level of the coccyx. So here, just here picture also, that at the level of coccyx, you have the pubic symphysis. Similarly, if we talk about the supralateral margins that are present in the abdomen, here this part basically forms what? The supralateral margins, right? So if we consider here that it is superiorly and laterally present, and this margin is basically termed as what? Costal margins. So costal margins are basically formed by 7th, 8th, 9th and 10th costal cartilages. Here are the 7th, 8th, 9th and 10th costal cartilages that form the costal margins here. As we further move on, here is a what? Xiphoid process. This is xiphoid process. This is sternum, or also called body of sternum, and this is manubrium sterni. And the ribs are basically attached to manubrium sterni and sternum and xiphoid process. So basically, this landmark is basically called as jugular notch. So it is what? It is basically called as what? Jugular notch. Okay. And here it is xiphoid process. So xiphoid process basically lies where? At the level of the T9 vertebrae. You have to remember such landmarks for the MCQ purposes, that here xiphoid process lies at the T9 vertebrae. Anterior superior iliac spine basically lies where? In the sacral promontory. So what is basically sacral promontory? Sacral promontory is basically an anterior projection of the sacral bone, and it forms the posterior margin of the pelvic inlet. So basically here are few structures that are protected by thorax that you have to remember, and few structures protected by the greater pelvis. The spleen, liver and some part of kidneys and stomach is basically protected by thorax, right? And the structures protected by the greater pelvis are the part of ileum, cecum, appendix and sigmoid colon. So you just basically have to remember this. So basically highest point of the iliac crust will be lying at the level of the vertebrae L4. So here will be the highest point of the iliac crust, that will be corresponding to L4 vertebrae. Okay. Now we talk about the tubercle of the iliac crust. Tubercle of the iliac crust will be at the outer lip of iliac crust behind anterior superior iliac spine. So here will be the anterior superior iliac spine, right? So if we move posteriorly 5 centimeter, we are going to have what? A tubercle that is called the tubercle of the iliac crust, and it is behind anterior superior iliac spine if you move 5 centimeter backwards. Okay. Now we talk about inguinal ligament. Inguinal ligament is basically present and between anterior superior iliac spine and the pubic tubercle. Spermatic cord basically is the structure present especially in the males, and it is downwards medial, present in the medial end of the inguinal ligament, where you can pick up with your finger and thumb, and you can easily feel it. We will talk about it in detail later on. Umbilicus is basically commonly you call it as a belly button, that is between the L3 and L4 vertebrae. So here will be the L3 vertebrae, right? So between L3 and L4 you will going to have what? Umbilicus, right? Okay. Now we further move on. Here's an important point about umbilicus, that skin attaches loosely to subcutaneous tissue except umbilicus. So skin basically tightly attaches to subcutaneous tissue at the point of the umbilicus, right? Next we talk about the lines. There are some 3 lines that you have to discuss here. That is first one, we will going to talk about the linea semilunaris. Linea means line and semilunaris making a semi-lunar shape. So basically it's from the costal margin tip of the 9th costal cartilage. Here is the costal margin and here will be the tip of the 9th costal cartilage. So basically from the 9th costal cartilage till the pubic tubercle, right? Till the pubic tubercle here, right? Till the pubic tubercle. That will be shown in the 3D animation also here. So this will be basically called as a linea semilunaris. Okay, and it basically corresponds to the lateral margin of the muscle. There is a muscle present here. So there will be a muscle present here which is called as rectus abdominis. There is an important point about rectus abdominis, that it is also called as six-pack muscle. Now we move about there is also another line also known as arcuate line, linea semicircularis and fold of the Douglas. So basically arcuate is derived from the word arcuatum, and arcuatum is a Latin word that means the curved arch. Okay, so basically this arcuate line lies midway between the umbilicus and the pubis. So there will be umbilicus, and here will be the pubis. So basically it will be lining somewhere here, okay, and it basically provide a base structure, a pouch type structure where the rectus abdominis is inserted. We will be discussing it on later. So linea alba is the fusion of the epineuritis in the midline. This is also the definition of the linea alba, okay. So it's basically fusion of epineuritis of all the muscles here, abdominal muscles which are present in the abdominal wall, that will be come from here and will be fused midway between. So basically they will be fusing midway between and making a very hard connective tissue, because you know that further in the abdominal wall there is no bony structure present. All the support is provided by the abdominal muscles and the epineuritis. So basically this will be the white line called as linea alba that will be present here. Superior abdominal wall basically is formed by the musculo-eponeurotic abdominal walls, and musculo-eponeurotic abdominal walls basically tends to is useful in increasing the intra-abdominal pressure, and basically this structure also accommodates the expansions that are caused by ingestion and the pregnancy, fat deposition in the obese people, and even in the pathology. Okay, now we are going to talk about some planes that are passing through this abdominal wall. There are 2 sagittal planes and 4 transverse, actually 5 transverse planes that we are going to discuss here. So 2 sagittal planes are basically mid clavicular planes. Mid clavicular planes, so here you all know that lies a bone, okay, the first bone that basically ossifies in human beings, that is called as the clavicle. And if you move from midline to 9 centimeter away, you will going to find a what mid clavicular plane, okay. There will be the here the mid clavicular line, and the plane here that will be formed will be called as the mid clavicular plane, okay. So from the midline till the mid inguinal point, okay, till the mid inguinal point, we're going to have what this sagittal plane. Next sagittal plane with the median plane, that is basically lying where the linea alba is and umbilical is. So basically this is the midway between this. So basically you have to remember what is plane. Plane is a 2D. 2D means that there will be y-axis and x-axis plane, okay. It's not basically a single axis. 2 axes basically joined to form a plane, okay. So this sagittal plane will be passing through the abdomen, okay, and the transverse plane will be transversely or horizontally placed. Sagittal plane are vertically placed like this, okay, through the abdomen, okay, and the transverse planes are basically horizontally placed, okay. Now we are talking about the transverse planes that are horizontally placed plane, okay. So number 1 is the subcostal plane. Subcostal plane basically lies at the level of the L3. So here if we say that there is a L3 vertebrae, so at the level of the L3 vertebrae and the inferior border of the 10th costal cartilage, here you will going to have what the subcostal plane. So if I draw here the subcostal plane, this will be what subcostal plane here, okay. Now the transtubercle plane is passing through the iliac tubercles. Remember, it's not the pubic tubercle, it's iliac tubercles at the level of the L5 vertebrae. So if we mark here the L5 vertebrae, so here will be what the transtubercle plane. So this will be the transtubercle plane. Now we talk about the interspinous plane. Interspinous plane will be passing through the adheres to iliac spines on the both end. So it's quite easy here. So this will be what the interspinous plane, okay. This will be interspinous plane. Next we talk about the transumbilical plane. So transumbilical plane, as the word shows umbilical, it will be passing through the umbilicus and the intervertebral disc between the L3 and L4 vertebrae. So if we mark here L4 vertebrae, so the intervertebral disc that is lying between this L3 and L4, we are going to have a what transumbilical plane. So here will be placed the transumbilical plane. Remember, the diagram here I'm showing is systematic diagram, and it's not the actual diagram, okay. So just you have to focus and just gain the concept. Last but not the least, we have the transpyloric plane. So pyloric basically word shows word pylorus of the stomach, right? So basically this plane will be passing through the pylorus of the stomach, okay. So that's why it is named as transpyloric plane, and it lies midway between the jugular notch and pubic symphysis. So here is the jugular notch. It's basically notch is also known as the suprasternal notch, okay. So from the suprasternal notch till pubic symphysis, it's halfway between this, we're going to have what transpyloric plane, okay. And it basically anteriorly it passes through the tips of the 10th costal cartilage, and posteriorly it basically lies on the lower border of the L1. So here if I demarcate here, if you can see, this will be what this will be what transpyloric plane, okay. This will be what transpyloric plane, okay. Now we talk about transpyloric plane passes through which of the following structures. So basically transpyloric plane will be passing through these structures: pylorus of the stomach, as named by this, hyla of the kidneys, fundus of the gallbladder, neck of the pancreas, origin of the cilioiliac axis, superior mesenteric arteries, hepatic portal vein, and root of the transverse mesocolon. Okay, so basically this is the diagram of the KLM, and here we will talk about the abdominal areas that are present in the abdomen. This is RH, basically right hypochondrium. This is left hypochondrium, right?
and this is epigastric. In epigastric, there is a slight depression here present. This depression is basically called as what? Epigastric fossa. Okay, so this is basically epigastric fossa. Now we talk about this is U is basically umbilical region. Okay, this RL right is this is right flank, okay, or the lateral region, and this is left flank. What is flank? The region between the rib cage and the superior border of the iliac crust is basically the flank region. Okay, this P is basically what? Pubic region, or pubic bone region, and LI basically left inguinal region. This is left inguinal region, and this is right inguinal region. So we have discussed about the abdominal areas. So there are about the four quadrants that are present here. This is the medium plane, okay, and this is the transumbilical plane which we talked about. This is the right upper quadrant, left upper quadrant, lower left quadrant, and right lower quadrant. Okay, and here you can see this is anterior superior iliac spine, and this is pubic tubercle, and basically in between two is present the inguinal ligament. Further, you can notice here the jugular line is present here, and the mid clavicular line, transpyloric plane is here, okay, and transtubercular plane here, and all the planes which we have discussed, and this is the pubic symphysis. Here you can see the site of the xiphoid process that is clearly available here, and the epigastric fossa which I mentioned earlier. The right costal margin here you can see, and this is the umbilicus point, and the iliac crust here, anterior superior iliac spine, inguinal ligament, and all those sites. This is basically, this dotted line is basically the semilunar lines. Okay, you can see here. Furthermore, there are certain margins that you can see about the muscles, right? So here you can see these lines basically represent the serratus anterior external oblique muscle. Here I was talking about the six pack muscle, which is quite visible in the males, and this is the rectus abdominis muscle. Okay, umbilicus lying at the level of the L3, basically L3 and L4 in between. Okay, vertebrae, and this is the inguinal region.
Talk about the four quadrants that you have seen in the diagram of the KLM. Right upper quadrant, basically its mnemonic we are going to list here is LG desperate. So LG is basically desperate. E is while missing, and E is also here missing, and E is also missing. We have missed the E in all desperate, but just try to remember it. LG desperate. Now L basically what? Liver. Basically, we have the structures of the liver, that is the right lobe, gallbladder, duodenum, first three parts, stomach, pylorus, and pancreas, ka head. And for right, we have right kidney, right colic, hepatic fixture, right suprarenal gland, superior part of the A for ascending artery, that is A, and T for the transverse colon. Okay, so that's about all about the right upper quadrant. Now we're moving on to the left upper quadrant. For left upper quadrant, we'll be having the liver, but this time we will have what? It's left lobe. Okay. They will be for what? Descending colon. So in the left upper quadrant, we are having the liver, its left lobe, ileum, its proximal end, spleen, stomach, jejunum, pancreas, its body and tail. For L we have the three structures: left kidney, left colic hepatic fixture, and left suprarenal gland. For T, we will be having a transverse colon, its left part, and the descending colon for D. So LIS JP limited has been done. Now we are moving on the right lower quadrant. For right lower quadrant, we have a mnemonic Kamaru. What is Kamaru? Kamaru is basically C will be for the cecum. So in the right lower quadrant, we will be have the cecum, appendix, most of the ileum, ascending colon, inferior part, right ovary, uterine tube, ureter, spermatic cord, their abdominal parts. Basically, these four structures will be having their abdominal parts. Uterus if it's large, and uterine bladder if it's full. Now we have moving towards the lower left lower quadrant. In left lower quadrant, we will be having what? We will be having L4, basically left. Left will be what? Ovary, uterine tube, ureter, and spermatic cord. Same four structures that are mentioned here. Ovary, uterine tube, ureter, and spermatic cord. These are the left structures that will be lying in the left lower quadrant. Next, we will be having the uterus. Again, that uterus and the urinary bladder that was mentioned above also. Okay, but they are again the same rule. The uterus if it's enlarged, and urinary bladder if it's full. Next, for the D, we will be having the descending colon, right? Descending colon, but descending colon is which part? For descending colon, we will be having its inferior part. Okay, and lastly we have S, and S will be for the sigmoid colon. It will be the sigmoid colon. So these are basically the four quadrants of the abdomen and the structures lying in the four quadrants.
Basically, here in this model, you can see that this is the xiphoid process. Here is basically formation of an angle. This angle is basically called as what? Costal angle and or infrastudded angle. So basically, this is what costal angle or infrastudded angle. Here is the jugular notch that was previously mentioned, or also known as suprasternal notch. Okay. These are the actually the costal margins. Okay, and so here basically you can see this is what actually this is inguinal ligament that I was previously talking about. So inguinal ligament extends from the anterior superior iliac spine till what pubic tubercle. So this is actually formation of the inguinal ligament. Okay, here you can see basically the superficial inguinal ring. This is superficial inguinal ring and this is deep inguinal ring. The inguinal canal is basically from the superficial inguinal ring till the deep inguinal ring, which we'll be going to study. And this is basically what iliopectineal arch that is formed. So here is the pubic tubercle. Sorry, here is the anterior superior iliac spine until we have what this is iliac tubercle. Now we can see here the iliac tubercle, right? You can see here. Here you can see this is what this is actually the linea alba. The line you can clearly see here, and this is what the point of the umbilicus that is clearly shown here. Okay.